as you say, there's a lot of people with health insurance, but a lot of those plans are high deductible, charging them $6,000, $7,000, before they can even begin to reap the benefits of the premiums that they've paid. So a lot of people do put off health care because of that. It's just too expensive even if you're insured.
Hey gang, it's Tuesday, July 13th. Lisa and listeners, welcome to the Behind the Numbers Daily and eMarketer podcast made possible by VTEX. I'm Marcus and I'm joined today by Lisa Phillips, who is our principal analyst covering digital health. Hey Lisa.
Hey Marcus, good to be here.
Yeah, thanks so much for hanging out. Today's fact, there's less gold than you think. So we all know gold is valuable because it's rare. It's hard to get an exact value for how much gold we've mined in all of human history, but some estimates put it at 10 billion ounces. That sounds like a lot, but it's actually as if you had a cube about a third the size of the Washington Monument. That's the most gold. That's all the gold that we've mined in history. We only mine the equivalent of a 14-foot cube, which is about the size of a single room. Pick a room in your house, it's about that size, of gold each year, of new gold. So a room's worth of new gold each year. Ironically, we've only mined about 1% of the gold in the Earth because the rest of it is in the planet's molten core. So, after researching this, I spent the rest of my day trying to figure out how to get to the planet's molten core for the gold. It's not easy. You gotta go through the crust. Then there's the mantle that's in the way. So as it turns out, I'm probably just going to do the podcast thing for a little bit longer.
Smart move.
Yeah. Thanks, Lisa. Today's real topic, the digital healthcare ecosystem. So in the first three quarters of 2020, US digital health startups raked in more cash in 1 year than ever before. That's because COVID-19 had turned the US healthcare system on its head. So where do players across the ecosystem stand on digital transformation, and what will healthcare's new normal look like? These are questions that Zoe LaRocque, Dane Finley, and Erin Ahmed of Insider Intelligence recently wrote about in their Digital Healthcare Ecosystem report. Lisa, 92% of Americans were insured in 2019. So it's an industry that reaches far and wide, that a lot of people use, but it's also a very complicated space. So when it comes to the US healthcare system, Lisa, who are the major groups and stakeholders involved?
Well, I go to the 3 Ps for that. We've got patients, payers, and providers.
Okay.
Patients are known as customers in every other industry. But healthcare, but they're called patients here. And it kind of shows that they don't have a choice, usually, about entering the healthcare system. Everyone has some level of health, and sometimes it's not as good as it is in other times. So they're unwilling customers in some regards. Yeah. Payers are what people know as health insurers, and that covers the government Medicare. It covers, commercial payers with Medicare Advantage and all employers who are self-funded but contract with biggies like Aetna, Cigna, United Health Group, Humana. And then we have the providers, which are health systems, hospitals, doctors. And now we're seeing major retailers, Walmart, Walgreens, Amazon are trying to get into this space as well.
Right. And then we've got the manufacturers as well, which may be a little bit further removed, the drug makers and the medical device developer people.
Yeah, the 4th P. You're right. Pharma.
Pharma, yeah. That works perfectly. I thought it was going to be 3 Ps and an M, but actually pharma is...
The 4 Ps, yes.
Begins with a P. Exactly. So drug makers like Johnson & Johnson, Pfizer, medical device developers like Dexcom, Dupuis Synthes. So yeah, let's go through some of those. You mentioned obviously the patients, the customers, but payers, private insurers, employers, or federal agencies. So private insurance covered 7 out of 10 Americans pre-pandemic. 2 out of 10 are covered by a public option. As you mentioned, some of those big private insurers, top 3, United Health Group, Anthem and Aetna. They covered about 130 million Americans. Lisa, as the report notes, there have been a class of ambitious startups touting digital solutions. It names Oscar Health, Clover, and Bright, which some of our listeners might have heard of before. I'm saying they're focusing on personalization, data-driven plans, and digital tools to boost customer engagement. How successful are these likely to be? There's been a lot of noise about them, it seems, but where do you stand on them?
Well, let's say some of them have already gone public through special acquisition corporations or SPACs, which are back in style for Wall Street. That doesn't guarantee anything. As a matter of fact, some people are pointing to the SPAC type deals and saying this is going to blow up again, like it did 10, 15 years ago in a different class. But they have a place. They're reinventing things. But as you say, they're digital first. They do have doctors and so on that they could fall back on, but they really put people through a digital experience before that some may not be ready for.
Yeah. So, a long way to go. Oscar Health, they say they've got 400,000 members. It was at the start of 2020, but that's versus tens of millions for the top insurers.
Oh, yeah.
Each of them have about tens of millions of folks. We mentioned, so that's private insurers. We mentioned employers as well as one form of payer in this ecosystem. 55% of the population get their insurance through an employer or an employer-sponsored insurance program. And then federal agencies, as you mentioned, the Centers for Medicare and Medicaid Services, CMS, and the VA as well, Veterans Affairs. 1/3 of citizens were covered by either Medicare, Medicaid, or a military healthcare plan in 2019, says the US Census Bureau. Let's talk about what's fueling the digital transformation of healthcare, Lisa. What in your mind, what are some of the main factors here?
Well, one I kind of mentioned, which is that everyone has some level of health. So, that may or may not need to be taken care of urgently. I'll just be real cute about it, and I'll just say it's unmet need and unbridled greed at this stage of 2021. As you say, there's a lot of people with health insurance, but a lot of those plans are high deductible, charging them $6,000, $7,000 before they can even begin to reap the benefits of the premiums that they've paid. So a lot of people do put off health care because of that. It's just too expensive even if you're insured. When I say unbridled greed, Rock Health just this week reported that in the first half of 2021, digital health funding has already surpassed the record year that they recorded in 2020. Wow. For all of 2020, they recorded $14.6 billion in digital funding deals, exits, whatever. So far this year, they've already hit $14.7 billion.
Wow.
Everyone wants to get into healthcare.
Right. Lots of money to be made. Absolutely. So it seems as though the pandemic obviously had a big impact on the digital transformation of healthcare in two regards, according to this report. One is, they say, from March 1st to June 30th of 2020, US hospitals and health systems lost over $200 billion due to low patient volumes and other coronavirus-related costs, according to the AHA. So there needs to be digital transformation to try to offer services to those folks.
Well, that is the most anomalific, to make up a word, period. That's when all the COVID lockdowns were happening. There was no elective surgeries announced. And this is where hospitals make their money, is on the elective surgeries. This is the sad part. They're there to treat acute care cases, but it's the elective surgeries where they can make their money. So they did lose a lot of money. Inpatient volumes, though, have been dropping for years. And even now, when they're coming back, they're still not going to be up to the levels that they were even in 2019, I'm betting, because so much care is being pushed out of the hospital and into homes, thanks to the digital transformation of healthcare. We have remote patient monitoring devices and so on that are aiding that.
So, I'm wondering what that new ceiling is, because as of October 2020, one third of US primary care practices said that in-person patient volume was within 10% of pre-pandemic levels, and 43% think it'll take over a year to financially recover. That was from Primary Care Collaborative Survey. What's the new ceiling, in your opinion? If 10 out of 10 people were going in person before, how far does that drop?
You mean going in person to hospitals? Or okay, you're talking inpatient volumes, meaning people who have already gone through the emergency department and maybe have been admitted, or people who had elective surgeries. Mm-hmm. I think the ceiling for hospitals is going to be lower. I'd say maybe 8 out of 10 of those would be going there because their health insurance plans, the payers, are now really trying to be aggressively saying, we're not going to pay for you to go to this hospital and have a joint replacement. We want you to go to this ambulatory surgery center, which is smaller. It's an outpatient thing. You're in and you go out, and then you get more home care, but you don't go back into that. And that's one of the things that is really changing hospital inpatient volumes as well.
Right. We also talked about telehealth. On the previous episode, we've been doing, it was our first health episode that we did a few weeks ago. So in-person visits, they are coming back to a certain extent, but demand for virtual care will remain high. 83% of US adults say they'll want to use telehealth even after the pandemic. That was according to a doctor.com survey. Yeah, telehealth slowed to take off pre-pandemic, Lisa. Adoption rates are about 11%, but the pandemic brought adoption up to 30% in March. So from 11% to 30%, and was at 36% by August, according to Civic Science. So that seems to be a pretty huge driver in terms of digital transformation of healthcare.
It is, but in the first 3 months, or actually through April of this year, starting in February, the usage of telehealth has been dropping. More people get vaccinated, more people, there's not the panic that there was about sniffles and so on, even though the Delta variant may be just manifest itself as a big headache and a runny nose, which feels like the common cold. More people are vaccinated, they're feeling less shaky about health problems, I think. So yeah, they're not maybe panicking and calling their telehealth provider as much, and they can go back to the doctor.
Right. Yeah, I'm wondering, so how much does adoption drop off then? Because it's always, we see a lot of consumer data around this, whether people have tried telemedicine or not. There were some numbers in this report about physicians and employers and their thoughts, their positions on telehealth. So in terms of physicians, Decision Research Group found that by July 2020, just 4 months after the World Health Organization had declared COVID-19 a pandemic, 80% of physicians, 8 out of 10, had conducted virtual consultations. That's up from 1 in 10 in March. So from 1 in 10 to 8 in 10 in 4 months. And then on the employer side, 82% of employers offering telemedicine in 2019, according to KFF, 76% of employers plan to expand telemedicine offerings in the next year. That's from August 2020, a Business Group on Health survey. We have our own telemedicine numbers. Lisa, is there going to be some kind of a flattening of adoption in the coming year or two?
I think so. Some of these surveys that are taken are done online when, they're not covering the people who don't have internet or broadband connection or just don't want. So some of these are a little self-selective. As I think, telehealth is going to level off at some point. It's become a must-have for health insurance plans because it is convenient. It is easy. Doctors switched to it because they wouldn't get paid. They couldn't see patients back a year ago if they didn't have it. Now I think I have not done my sample of one to speak to my own physician to find out. I know he didn't like doing it last year, but was compelled to.
Right. What did he not like, or he or she not like about it?
Did not like just how impersonal. Couldn't see exactly the person's body language and everything, which told him so much about how somebody was really answering a question, maybe. I don't know. Yeah. Anyway, it was not as effective as an in-person visit. And I think a lot of people experienced that as well.
Right. Right. It has its place if you need to read some results to somebody or, a quick checkup, maybe a quick 5-minute follow-up. But yeah, there are a lot of instances where it just doesn't do the job. I just pulled up our numbers. So we had 8% of people using telemedicine in America, 8% in 2019. That doubled by 2020 to 16%, but flattened right out by 2021 this year to 18. So from 8 to 16 and then 18, and then it's going to go up to 21 and eventually reach 26% by 2024. But yeah, it definitely does slow down.
Well, there are areas too where when we use telehealth, it's a very broad term. Telemedicine is what we define things as, which is a real virtual visit with a healthcare provider, whereas telehealth can encompass just getting an appointment or something,
Got it.
Scheduling or something. But I think there are instances where this may just continue and has been a boon for some areas like behavioral health, telepsychiatry, and working with autistic kids, or just quick check-ins and so on with some patients and so on. It definitely has proven to be a boon in some instances.
Mm-hmm. All right, let's take a quick break for a word from our sponsor, VTEX, and then we'll be right back with the rest of the conversation. Retail's next competitive threat may come from a business model or channel that didn't even exist a few months ago. This modern dynamic requires companies to adapt quickly, pivoting business seemingly overnight, something traditional commerce platforms just can't support. There's a new enterprise commerce platform on the rise, one that's fast, flexible, and doesn't require 9 months and $1 million to get up and running. Go to vtex.com/eMarketer to learn more. A few other things that were noted with regards to what's fueling digital transformation, the digital transformation of healthcare. One was the shift to value-based care, or VBC. What is this?
That was put in, the ball got rolling with the Affordable Care Act adoption back in March of 2010, but that is and the CMS has been pushing it through things like bundled payment initiative, and making it mandatory for some hospitals in some areas. You're going to do these joint replacements, and it's going to be the whole team, and trying different ways of making this work. They get paid by the outcome, or the healthcare providers, the whole suite of healthcare providers involved in one patient's episode of something gets paid a flat fee, and they have to work out whether they make money or lose money on that. And so that's a very complicated process. Say somebody shows up in the emergency room doctor might become you're going to be sorry you asked this. the emergency room doctor becomes like the lead provider in the whole episode that can go through the hospital. The patient goes through the hospital and then gets transferred to a long-term care facility, or a skilled nurse, which is called SNF, a skilled nursing facility. And then into post-acute care and maybe a rehab facility. How do you work out that everybody gets paid and so on? And that's where a lot of digital transformation has taken place, way out of sight, is companies that are specializing in these value-based payment systems.
Okay, got it. Another section was the consumerization of healthcare. So they're saying 8 out of 10 patients said they'd switch providers solely for quote-unquote convenience factors. They'd switch providers solely for convenience factors. This was 2019 per an NRC health report. The report is saying consumers are accustomed to convenience, consumer-centric services, and everything from retail to banking experiences, and these expectations now extend into healthcare. What does the consumerization of healthcare mean to you?
Well, it doesn't. What it means to me is that this is where primary care is meeting Main Street. This is where Walgreens has partnered with VillageMD and invested $1 billion in VillageMD. Just today, they announced they're on track to open 600 VillageMD clinics adjacent to a Walgreens somewhere in the United States in the next 4 years. And 29 more today, they announced. Dollar General just announced that they have hired a chief medical officer. Very first time they've
Dollar General,
because they have a bigger footprint in the rural United States than Walmart does. More people are within 5 miles of a Dollar General than they are, within 10 miles of a Walmart. Dollar General now, of course, all they're doing right now that they announced is they're beefing up their over-the-counter healthcare products.
Okay.
I don't see them getting into telehealth, but when we say the consumerization of healthcare, I also kind of see that as this is where patients are going to really become consumers, or that's the way the healthcare providers had better start looking at them, because price transparency is going to take maybe the rest of my lifetime to actually happen, but it will have to happen in order for interoperability to happen across healthcare records and payers and providers, so that everybody can see that I was admitted to an emergency room in Boca Raton, but my provider is in Connecticut. They get that flag right away, and they go tell them in Boca Raton, no, she doesn't need to be in the emergency room. Send her to an urgent care place.
Right.
Not that's going to happen now, but there's an awful lot going on, especially in the retail, to the point, here's where COVID changed everything, is with Walgreens, CVS, and a few other, Walmart, providing COVID vaccines.
Yep.
People flocked to it. But at least Walmart and Walgreens insisted that in order to get an appointment for a vaccine, you had to set up an online account. All three of these chains got new users' data, name, address, phone number, text messaging, and email address.
Yeah.
And they could tell. I mean, CVS already said, we had 8 million people who had not filled a prescription with CVS in the previous 12 months, came in, signed up for a COVID vaccine, series of them. Walmart, when these people came in, they had their pharmacist, you had to stay there for 15 minutes to make sure you didn't have an adverse reaction. Talk to them about ice packs, talk to them about ibuprofen, trying to, sell more.
Yeah.
So, I mean, it works both ways. I mean, they got a lot of data for giving away free shots.
Let's finish the episode by talking about digital tools. So which digital tools are leading healthcare's digitization? We talked about telemedicine a fair amount, but what other digital tools are driving healthcare's digitization?
Top of mind is artificial intelligence, machine learning. This is out of the spotlight because it has to go on in the background. And I will say it's still in its infancy. I've heard people say that artificial intelligence is about as intelligent as a toddler, a 2-year-old. Because, and it's still garbage in, garbage out. If you don't know what you want from the data, you can collect all the data in the world. But if you don't have the right tools to mine it, then you're not going to get it. One of the interesting things I just heard the other day is natural language processing, which is getting the data and to the point is there's no standardization agreed to in healthcare about normalizing data. Right. So some big payers and providers are just running natural language NLP programs on top of it just to try to figure out what they've got.
Well, on artificial intelligence, I found the voice-enabled EHR integrated digital assistant. So I think it's called Suki, S-U-K-I, was fascinating. So it leverages machine learning and natural language processing, as you mentioned, capabilities to complete administrative tasks. So as you said, they're not the most advanced systems at the moment, but they can still perform some kinds of functions. Suki indicates its platform is capable of cutting the average time spent per clinical note by 76%, reducing the amount of time clinicians spend on notes from 14 minutes per note before Suki to 3 minutes per note after leveraging this device, which seems to be a big deal. Medscape found that too many bureaucratic tasks, paperwork, charting, things like that, was the number one cause of physician burnout by a country mile, way more so than spending too many hours at work, apparently.
Yeah, they didn't sign up to fill out paperwork. You don't go through med school for that. But there's a lot of other companies out there. And I will say Amazon Web Services has its own huge transcription scribe service and who signed up with them? UPMC and Cerner is a client of Amazon Web Services. I mean, there's, physician burnout and filling out paperwork. That is an easy thing for artificial intelligence to do.
On the other side of things, though, artificial intelligence, there was a concerning part of this report I read about insurers using predictive AI to identify high-risk members and personalize care recommendations. It says to improve patient outcomes and reduce member costs. So if someone's healthy, that sounds ideal because maybe your costs will be lower. But if you're someone who's not healthy, whether it's because of a lifestyle choice or otherwise, if it's hereditary or whatever, or if you have an accident, this did make me be a bit more skeptical, a bit more nervous about the idea of AI determining how much things could cost based on how healthy somebody is.
Well, the way it's framed in many discussions and stories is that 20% of the people cause 80% of the healthcare expenses. So we want to identify them, and that's where the social determinants of health come in and population health management. Another way AI is, to your point, is helping to identify some people at risk. Yeah, I hear you on the data privacy issue. As a matter of fact, that is my next report. I'm going to be doing healthcare data privacy. Not necessarily, obviously cyber attacks on healthcare facilities are a huge issue, but they're a huge issue everywhere, as we've seen recently in this country. But when CVS bought Aetna, some people were saying, hey, what if CVS, they marry their data and Aetna starts saying, well, we're not going to, we'll insure you if you wear this armband or wristwatch or something, and then we can check your blood pressure all the time.
Yep.
Or there's a lot of seemingly innocent.
Yes. Yeah, absolutely. Another area I want to quickly touch on before we wrap up here is clinical researchers as an area which is working on its digitization. And so the pandemic, apparently, according to this report from Insider Intelligence, the pandemic delayed 2/3 of clinical trials because folks couldn't get in to conduct the trials. So human clinical trials take an average of 6 to 7 years, costing between $1 and $2.5 billion. This is according to Taconic Biosciences. They said Boston-based biotech Vertex makes drugs for things like cystic fibrosis and announced it's shifting to virtual visits and drug delivery for some of its ongoing trials to participants, so they don't have to go to trial sites. This was reported by MedCity News. So a very interesting area of healthcare, Lisa, that maybe doesn't get put front and center as much, but clinical researchers taking advantage of healthcare's digitization.
Oh, yeah. I mean, just even they're using AI and so on to try to find patients who fit a profile for maybe a rare drug, or what is, an orphan drug that they're trying to develop. But yeah, when you talk about precision medicine that can treat one type of small cell lung cancer versus a different kind of small cell lung cancer, it helps with that. But finding the right people to go into a trial for those kind of medications, and yes. The FDA had to agree to let this happen as well. But yes, it can save people. It will really help keep people in these trials. Mm-hmm.
Well, that's what we've got time for, Lisa. Your report, health data privacy report, is something along those lines?
Healthcare data privacy, yeah. Looking at that
healthcare data
now.
Privacy coming out roughly when? Which month?
Oh, not till September, maybe. I'm not sure.
Okay, sometime over the next month or two.
Playing it as it lays, yes. Exactly.
Okay, terrific. We'll look out for that.
But we will be redoing another digital health ecosystem report at the end of the year.
Okay, terrific. So yeah, if you're a pro subscriber, Lisa's healthcare data privacy report, look out for that in the coming months, and also an updated version of the digital healthcare ecosystem towards the end of the year. That's it for the show. It's time now for the post-game report, where we summarize the key takeaways from a lead story in 30 seconds or less. So Lisa, what are your takeaways from this episode?
Digital health is changing everything, as you say, from clinical trials to post-acute care where people can go home and be monitored remotely and cared for, even in a hospital-at-home type situation. Everything's moving out of hospitals, which used to be the crux of our healthcare system. So, you've got all these retail companies wanting to get in. It's a wild time.
Yes, indeed. In all aspects of life, unfortunately. That's what we've got time for this episode. Thank you so much, Lisa, for joining me.
Oh, it's been my pleasure, Marcus. Thank you very much for having me.
Of course, and thank you so much to Victoria, who edits the show. Thank you to everyone listening. Nicole Perrin will hang out with you tomorrow for the Behind the Numbers ad platform, an eMarketer podcast made possible by VTEX, where she'll be joined by former eMarketer principal analyst, now over at Advertiser Perceptions, Lauren Fisher, who those two together in a room, not in a room, you know what I'm saying, in two separate rooms talking to each other. You're not going to want to miss it. They're both geniuses.